Yeah, thanks, Kate. So yeah, just to quickly introduce Dr. Sarah Kelly. She's a human environment geographer with over 15 years of experience conducting community-based research in Chile, the US, and Mexico. She currently heads the Energy Justice Clinic and lectures in the geography department at Dartmouth College. And her work focuses on participatory methods and explores how community needs, infrastructure, environmental justice, and the law intersect. So on the EJC website, you might have read about the work that she leads with her students on supporting vulnerable communities in heating and electrifying their homes. And so today she'll be sharing a bit more about her work with frontline communities and to get us to think a bit differently about energy justice and resilience. But before we begin, we'll do a small activity to help people understand the connections between energy and heat. So what does energy has to do with heat or vice versa? So we're just going to take a few minutes to check in together. And then if you can, I'll just invite you to head on over to menti.com and enter the code 55241895. So I'm just going to, hi, Yusin, I'm just going to plug that into the chat really quickly. Awesome. Thanks so much. Yeah, so the first question that we're trying to get a sense of who's in a room and people's understandings of energy and heat resilience is, what is the first word that comes to mind when you hear the word energy? So scarcity, nature, divestment, regenerative. Electricity is a big one in the middle with solar, wind, renewables, and fossil fuels. Yeah, and feel free to take your time to add on as well. Yeah, so I think we wanted to just start off with this question to show how energy can mean many, many different things to each of us, whether it's power, electricity, movement, or rising bills. And hi, um, so energy isn't just something that powers our homes and devices, it shapes how we live, how we move and experience the world. Sorry, having a little hijack by my nephews. Yeah, so as the climate changes, the role of energy becomes even more critical. And in Singapore, we know that rising temperatures and energy demand are affecting how we live and how we make everyday decisions. Um, Sorry. Okay. So some of you might have come across the term energy justice. And when we talk about energy justice, it's not just about switching to cleaner or renewable energies, but in simple terms, it's really also about asking who has access to renewable, clean, affordable energy, who gets to decide, and also who bears the burdens, whether it's rising electricity bills, pollution, or lack of cooling during heat waves. So that leads us to the next question, which is, which aspect of energy justice do you think is most important?
But I'll rise again.
I'm so sorry. This one. Yes. Okay, hold on.
You get
Yeah, so when we talk about energy justice, there are many aspects. Yeah, so I think the point that we want to that we want so sorry. Yeah, sorry, just to quickly debrief this question again, so sorry. I think the point that we wanted to drive home with this question was to show that like all of these aspects of energy justice are important, but depending on like where we are or who we are, some of them might be more urgent than others. And so for today's session, we're going to be focusing on the unequal distribution of impacts. So one of the clearest examples of these lies in how we experience and respond to heat, especially in Singapore. So I think in Singapore, some instances that we know of are how some households can afford to run on air conditioning while others rely on fans or have to cut back on usage because of bills, as well as communities such as people living in older rental flats or even outdoor workers like cleaners, construction workers, and gig workers who are more exposed to heat but may not have access to cooling spaces during their breaks. So with this last question, we'll take a moment to reflect on our own lives. So how do you think heat affect your daily lives? And so something to think about is maybe because of the heat, you feel a certain way or you take certain actions, or when it gets really hot, how does it make you change the way that you make decisions in your daily lives? We'll just take a really quick moment to share some of your personal experiences before we jump into the webinar itself. Yeah, I think some people are saying more short-tempered. I definitely resonate with that. I feel super sweaty and sticky and I don't want to do anything. Turning on the aircon, feeling unwell, lethargic, debating about taking another shower, less energies to be outdoors, reaching out for a cold drink, taking the bus more than walking back home. And so I think even in all of our daily lives, it's really clear that it affects how we make decisions, our moods, our emotions, and our health. And so through that lens, thinking about how it might affect other people in our communities as well, even people that we might not know of yet, or communities that we haven't yet built a connection with. Yeah, so thanks everyone for taking part in this small little activity. I think with this, we can already tell how heat affects us differently. And that's when heat really becomes more than just an issue about weather. It's clearly a justice issue. And so as the climate gets hotter, we need energy systems that can do two things. Not just reduce emissions so that things do not get worse in terms of our emissions rising, but also energy systems and solutions that help us live safely with the changes that are already here. So as we move into today's session, just keeping in mind that when we talk about a just energy transition, it's often one that is always one that is also heat resilient, and communities are stepping up in their own ways to build heat resilience with one another. And we'll be exploring that today, especially with what SYCA is going to be launching soon. And some of you are a part of that initiative as well. So thank you so much for participating in this activity. I'm going to stop sharing my screen and now handing over the time to the SYCA team, Kate and Natalie. Thanks for having me.
Thanks, Rachel. Hi, everyone. So my name's Kate. I co-lead programs at SYCA along with Nat, who is in this presentation as well. And yeah, I'm actually also based at Dartmouth College right now, which is how I know Sarah, and kind of crazy to see like both my worlds colliding today, but I'm loving it. So I just wanted to share some context about the SYCA Heat Outreach Program, which we just launched a couple of months ago. And this really started as an idea back in 2023 when Singapore was like breaking all these new heat records. I think 37 degrees Celsius in May of 23. And that really brought us to the question of, what can we do as an environmental organization? I think there's been a lot of systemic focus on heat in Singapore, which is great. It's come up in Parliament. There's the new NEA heat advisory. But what we really want to hone in on is bringing attention to individual lived experiences with heat in Singapore. And secondly, like how can we tangibly support vulnerable communities in better coping with heat? So we're doing this in several ways. The first is since I think September of last year, we've started connecting with social workers around Singapore to really try and gather insights as to how heat comes up in their conversations with their clients. We've landed on two long-term community partners, Care Corner SG and Kampong Kapok Family Service Center. These are groups that have already been, working on the ground for years and have already built really strong relationships with the residents there. And so that's something that we really want to lean into as opposed to like starting from scratch. We have a team of about 25 volunteers. And so we're basically planning to do long-term outreach with residents around Singapore, with a specific focus on lower income communities and rental flat communities. So currently our team is going down to these breakfast sessions in Tampines on Saturday mornings, which is run by another ground up group. And we're basically gate crashing those breakfasts with permission. It's run in a void deck, and our volunteers just go and speak to the senior citizens about, what they feel about weather in Singapore, what are some of the cooling strategies they use, and how is it effective or not for them. In the longer term, we want to do focus group discussions and also house visits where we'll be tagging along with social workers when they visit clients. And that's just so that we can get more in-depth responses and really try and understand the struggles that people face and ways that we can plug in. Yeah, and so that's what we have in the works for this year. This is a pilot program, but we're hoping to expand it beyond Tampines if like everything goes smoothly in the next few months. Also, just wanted to give a shout out to the Lian Center because they gave us a grant to do this work. For example, like we have NTUC vouchers for the residents that we engage with so that we make sure we're also compensating them fairly for their time. In terms of just like tangible deliverables, I think the first is really just collecting qualitative data and stories on people's challenges in coping with heat in Singapore. But we also really wanted to provide something tangible in terms of supporting households in need. So whether that's crowdsourcing fans for people who need it, or there's a researcher at SUTD who is basically looking into rearranging furniture in rental flats to try and improve ventilation. So that's also one way that we're collaborating with others to try and support residents. And based on all of this, we're planning to launch a public campaign in the second half of this year, as well as basically gathering our insights into a report and sharing it with policymakers to drive more awareness of heat inequality as an issue. Okay, and just to wrap up this segment, these are some of the insights that have emerged in our conversations with social workers as well as our outreach sessions. But before that, if you just look at the photo on the left, this is a rental block in Tampines. And the first thing that you can see is just how crammed the units are. They're really tightly packed. And also, if you think about like HDB blocks you've seen around, usually most of the units would have ACs, but in this one, it's very few. Like you can literally count it on both your hands. And so something we've learned is that there's like a pretty high threshold of medical documentation needed for people who want to install air conditioning in rental flats. The second problem is because the flats are so tightly packed. Sometimes if families want to have private conversations, they don't want the neighbors to hear. They'll close all the doors and windows so they can have some privacy, but that will create a very stuffy environment at home. And third, and I think most directly relevant to today, is there are a lot of families who actually have fans or even like a portable AC, but they realize after they purchased it that when they use it, it actually really drives their utility costs up. And so because of that, it's sort of just sitting at home and they can't really use it because then it creates an affordability issue. So these are things that are starting to come up in our outreach sessions, and we are really going to try and shift our focus in the next few months to coming up with solutions, hopefully, to try and plug these gaps. So yeah, that's the SYC Heat Outreach Program. If anyone has questions, feel free to drop me a message in the chat, but we really want to turn the time to Sarah now to share more about the work that she does.
Hello, everybody. It's good morning for Kate and I here at Dartmouth, and good evening to you all. Yeah, I'm as Rachel said, I'm Dr. Sarah Kelly, and I lead the Energy Justice Clinic here at Dartmouth College, and that's how I got to know Kate among a lot of other amazing youth leaders here at Dartmouth. And so today I want to talk a little bit about a research project that we've had for 2 years here in our region that crosses Vermont and New Hampshire. And then I'm going to pivot to a paper that I think is helpful for you all around heat in particular, because here it's cold. We're in a cold region. And so the energy burden is much more around heating people's homes, which I'm going to talk about today. But I think there's a lot of similarities that are helpful to think across. So Please feel free to like write questions and I'm happy to like have a little discussion afterwards. So yeah, this is a collaborative research project. Everything we do in the Energy Justice Clinic is community-based and participatory, and we really try and kind of build a structure so that students lead projects, but with a training about how to do social science research. And every project is different based on the community partners and the community needs. But in hearing from about what you're doing in your project, I think it sounds amazing to partner with the social workers. They're clearly a group that's going to know a lot about those community needs and who's most vulnerable and what are the barriers that people might be dealing with to get access to ACs or other issues. So I think we would take a similar approach if we are working where you all are. But yeah, this project is led by Piper and Ella and Archie, three students in the Energy Justice Clinic. They're actually going to be meeting soon, so I told them to pop by and say hello if they can. And then it's with myself, and we have a government professor who does, Professor Jen Jarrett, who is specialized in surveys. So we've done a mixed methods project where we've done sorry about that. We've done surveys first of people's energy burdens and experiences, which is quantitative. And that's like what a lot of the research that exists on energy burdens is. But a lot of that doesn't get at the lived experiences of people and how they kind of the more qualitative side, their own stories, their own struggles. And so I think it's great you're doing focus groups because we found in our research that the qualitative research has been really revealing. And this has been really like asked for first by members of the Lebanon Energy Advisory Committee, who are a volunteer group of people who worked in housing justice and energy justice for a long time. And then a Dartmouth graduate from a number of years ago who works in community health. So they're really who commissioned this study. And I'm going to talk a little bit about it today. So yeah, we've ended up working with a number of other organizations over time as they've gotten to know our project and kind of build out a broader coalition of collaborators. And I find that like particularly if you're looking at policy solutions, building out a broader coalition of nonprofits or other groups that are part of your work means that you have more supporters. So I do think that's a good strategy for any type of research project if you can find other good partners to champion or give you access to other populations. So this is our group that has grown. So our research objectives were to first address gaps in rural energy and security knowledge and the rural energy efficiency gap. So here we're in a region that is not urban. It's much more kind of pockets of small urban centers, but primarily rural. And there's a fair amount of research coming out to say that rural areas are slower to develop energy efficiency, and they have a higher percentage energy burden than urban areas. So it's a critical geography that needs to be included in the energy transition, but is often left behind. So we started with studying rural areas because we knew about those needs. And because a lot of the research that exists on energy burdens is in New York City or big cities. And so there's good research done, but it's not applicable to our region because energy justice is place-based. So its meaning and how it's experienced really varies depending on where you are. So we started with quantitative data and we wanted, our community partners were in particular interested in getting out some funding applications we had a big, the Inflation Reduction Act passed, which was a federal bill that really allowed for a lot more funding via tax credits and different loans and other mechanisms to support the energy transition. And our community partners wanted data to be able to access grants. So that's where that need started. And it really grew to consider the interrelated forms of insecurity that people experience and also to support policy formulation to alleviate energy insecurity. And so that's where we're at now. Probably following it, we've had a different government change. So there's kind of a different landscape in terms of funding and needs right now in the United States, but that I feel like it's actually made our research even more important given there's been a pulling back of funding for the low-income home energy assistance program, which is our federal program to support people with low-income needs to heat their homes and get fuel assistance. So, this is a critical issue for people's health and well-being. So just to look at these two concepts, these are two interrelated concepts. The energy burden is the percentage of gross household income spent on energy costs. A high energy burden is considered over 6%. And our region in the Northeast has one of the highest energy burdens in the country, particularly for low-income communities. Whereas energy insecurity is kind of a broader concept, and it's about being unable to meet household energy needs. And it can include physical, mental, and emotional health impacts. And actually, in our research, we've really learned a lot about the emotional and mental toll that it takes on people to always be living under the stress of trying to get the bills, like get the money together to pay for a particular filling up their propane tank or their oil tank to heat their home. And it's something that in our region, people start in June thinking about to get it filled for the cold starting in November. So it's like a real stressor for people. But I also think it's important, like that you all were focusing on the elderly population because the literature shows, and we found like the people that are in the home more are the people that are suffering more, right? So that's typically our young and our elderly who or people on disabilities. Because people who leave to work all day, they're not dealing with necessarily like the worst heat or the worst colds, but the people who are in the home more are dealing with those discomforts more and most likely have a fixed income and so are unable to adapt and spend more to cool their home. And so in our work, we've learned about and kind of connected it to this idea of total insecurity because it intersects with food insecurity, housing insecurity, and like the need to pay medical bills or deal with medical issues. And really like people I don't know what the costs are in Singapore, but here in the United States, the costs for housing and food have gone up significantly. And again, it comes back to like the benefits people receive from the government have not gone up to match that inflation. And so people on fixed incomes and renters are some of the most economically precarious to these changes. So this is the project timeline for our research. We designed the survey and then we piloted it at some local community settings with community partners. And then we got our finalized version and got approved to do a larger scale research project at the university. And we operated it, getting 127 responses at food pantries, thrift stores, dining halls, and senior centers of local nonprofits that work with low and mid and moderate income communities that gave us permission to administer there. And then from there, we moved into in-depth interviews. And what I'd say is, the nonprofit we work with, Listen, also has social workers working there. And I'd say that one thing we had to navigate that you all might have to as well is that some people didn't feel comfortable speaking to us about these issues. Like I don't know what happens culturally in Singapore, but here in the Northeast, like sometimes people are shamed for receiving those services. And so really kind of thinking about how to make people feel most comfortable in talking about these issues was important in our study. So we ended up first offering to like meet people at a breakfast joint or like a library or something, but most people didn't come, even though they'd said in the survey that they were willing to. And we were also providing a gift card to thank people for their time and compensate for the time and the travel that they needed to come there. But eventually we worked with the nonprofit and invited people to come to the nonprofit office where they already felt comfortable. They were already dealing with those issues and ended up having one of the nonprofit employees who works with the elderly population be present during our interviews. And so that was what worked. That was where people feel comfortable. We had more people come and we had some really important interviews with people facing high energy burdens. And, I was already interested in this issue, but hearing people's stories made this issue matter a lot more to me. And I will say that it was surprising. We started doing this research. We were kind of doing a lot of the interviews during the political elections in the United States for president. And it was interesting hearing about how the elderly felt left behind by the energy transition. They felt like it was an elite transition that was occurring. And a lot of them were really upset about electric vehicles. And like, I didn't expect that, right? Like, these are the things you find in research that surprise you. But a lot of people didn't feel that they were ready to like transition to a different type of vehicle at their age. And they felt that like a lot of the people campaigning for political positions were insensitive to their needs. Like they were asking about how to heat their homes, and someone running for senator said, well, just use some more blankets. And wanted to talk again about charging stations for electric vehicles. And so it just showed to us that like this population felt like they weren't being consulted and weren't being included in the energy transition. And it really challenged that idea of like, the electric vehicles didn't resonate with every population, right? So it's just, you learn different things about, like, I love that you guys just had this questions about energy justice and like they're all interrelated, right? But it was I did not expect in our research process that we'd hear about all the issues people have with electric vehicles. So right now we're in the stage of presenting our research. We just had a great presentation at a senior center that we had originally administered surveys a while back. And we had people come from across sectors, and we also had some like aides to our state senator in New Hampshire come. And that was really important because it allowed this group to really kind of feel part of the research process and help us think about moving from the research findings to the policy outcomes together. And people are interested in making a working group because we have ideas for what could happen for policy outcomes, but we alone can't do much about that, nor should we, right? And so having these type of community consultations for the research process is really part of the piece, and bringing key actors is part of the way to move from turning research findings into policy outcomes. So yeah, this is just a little bit more in depth about our research process. Obviously, like with working with students, we try and teach to have the research not be extractive, and students to have like a cultural awareness and an ethics as researchers. So that's part of what they get trained in. And one of our community partners was key to training a lot of our students, and she taught them about mirroring language. And basically, what she said is like, nobody wants to be labeled as insecure. Like being labeled as energy insecure produces anxiety for people. And so while we're studying energy insecurity, because that's a concept that's talked about in the literature, we don't label it as such for people in person. We talk more about the energy burden because that's kind of, and costs around energy because that's more relatable, and it doesn't make someone responsible. It doesn't make someone feel bad in the same way. So we mirrored language. So if someone talked about being homeless, then we would say, we would refer to that as being homeless. If they talked about being unhoused, we refer to that as unhoused. So mirroring the language that people use to talk about their own situations was the best way to kind of make people feel comfortable and not label them in ways that made them not feel good. So that was part of the training students got to start this work. And then in our interviews, we not only interviewed people with high energy burdens, but we interviewed a lot of the service providers, so social workers and different agencies, because and I'd say like that may be a good idea for your research as well. Hey, do you want to say hi to the students of Kate's? Oh, yeah.
Hi, Archie.
Hi, Kate. Hi, everyone.
So I was just talking about our research process. Do you want to just say hi to it's all youth from Singapore. So
Okay.
they're doing a heat study, but I was just sharing our research
Uh-huh.
and how you all were kind of trained, and I haven't gotten to our findings yet, but
Okay.
if you want to just talk about it from your experience for a minute or two, I'm sure people would love to hear it.
Yeah, sure. So I've been working on this project for about a year with LM Piper. Like Dr. Kelly was just mentioning, we worked really closely with like community partners and service providers throughout this entire process to make sure that the language that we were using in our interviews and in our surveys were not accusatory or placing blame in any sort of way, because there is already a lot of shame and like a sense of stigma surrounded with like asking for help, especially in this region. Um, yeah, I see you're on the interview side. So
Do you want me to pop ahead? I just went through it.
yeah,
I was
sure.
just getting to our findings.
Oh, okay, great. Yeah, I mean, I guess one of my main takeaways that I thought was really interesting and kind of fit into like this weird political context that's happening in the US right now is just sort of the lack of faith in like distrust in like government and local politicians. Some of the people that we talked to mentioned that like local politicians had made like callous remarks about the energy transition. There was one person who talked about how she expressed to a local politician that she wouldn't be able to afford the energy transition, like afford to change, to update her home energy infrastructure. And the politician responded with, like, I guess you'll just have to buy more blankets then. And so it's like those little interactions and also just broader patterns of government not adequately responding to the needs of the people. Like people can't afford to live right now. That's sort of one of the main takeaways. And I think the fact that the government has not supported them is just creating a sense of desperation that's led to where we're at right now. So,
Thanks, Archie.
of course.
Thanks for joining us.
Yeah, wait, this is amazing. Let me know if I can help in any way.
Do you want me to send you, do you want to pop in too, or?
Yeah, I can pop in.
Kate, do you mind sending Archie the link? And then if you want to say anything else, just go ahead. So yeah, that's one of our student leads, Archie. I'll just go through these rest of these findings. So yeah, benefit cliffs, it's an existing concept, but this is actually one of the more important findings of our research. I don't know how it works in Singapore, so maybe we can talk about that afterwards. But here, there's federal benefits that people can get to support if they're low income or low to moderate income for their different costs. And there are different programs, and they're all kind of patchwork. And so what happens is people will change their income via like getting a raise or getting a different disability amount or social security, and then that changes how they access different programs. So like the one case of this was that someone went up $50 in their income and then they dropped down $800 in an energy support program for their fuel assistance and energy costs. So they're like these cliffs of you change a certain amount in your income or in some particular income, and that changes the benefits of other programs. And so we found in our data, both across the quantitative and the qualitative, that the people who are most like emotionally and mentally suffering are not the lowest income, but like two rungs up, still low income, but at that point in the benefit cliffs where they're not getting enough support. So that's part of why this type of research is really important, to get at who, at different income brackets, who's dealing with different types of burdens and challenges. Again, like Archie said, this total insecurity reinforcement about better understanding the trade-offs and hearing about people's lived experiences about, my energy costs went up, so I couldn't get the surgery done. So I have to, this one extreme case, a woman in her 70s had a whole a whole summer of eating just peanut butter sandwiches because she couldn't afford other food to cover her energy and heat costs. And here in the United States, when people get into arrears or like back payment with the utility, eventually in most states, they just get a letter saying, we're going to cut you off from your electricity because you're too far back in payments. And that often is the first step to being unhoused. And so it's, there's different states that have started thinking about alternatives, but how to handle people on back payments with utilities is a big issue here. A normalization of extreme adaptation mechanisms for unreasonable prices. Those can also really affect people's health. So like imagine not heating your home fully and mold growing, right? And then needing to use an oven to heat your home instead of the propane tank because you're out of propane, you can't fill it again. So these multiple ways that people adapt also affect their health. Then that leads to, lack of faith and distrust in government, lack of optimism. Here in our region, there's this kind of hardiness mentality and individualism. And so people don't want to ask for help, which also plays into, and they don't want to, like some people don't want to receive social services. So there are some people that suffer because of that belief. And I already touched on the elite energy transition, the electric vehicles issue. So yeah, here's just a bit more information, but of the benefit cliffs, one person said you get punished for every dollar, saying that like when you increase your salary, you get punished for that. Yeah, I think I already went over all of this. The lack of trust, here's some quotes on the side. We won't see the federal help. It's going to be chopped off the way you chop off someone's arm or leg. And I hope they don't go after Social Security because if they do, if they try to make a cut there, we're already starving. So today we're looking at an uncertain federal funding landscape in the United States. We found real differences. Again, we're in a federal system. So Vermont, which is the state just across the river here, they have a lot stronger social services and programs, whereas New Hampshire does not. And so New Hampshire is arguably much more vulnerable in this current moment than Vermont is. And we'll see how that plays out, but that generally is the trend. We see different coping mechanisms among people in response to this, and a continued lack of trust in government and business. So these are the current challenges that we have. Obviously, we're also thinking about policy solutions, and I feel like you always have to be hopeful, right? So there's always ways to go forward, but it is a significant, we have a significant set of challenges right now in our region. So some of the remaining questions that we have, and these were questions we posed to our community partners, but you know, how are people experiencing energy costs now? What's the future of the funding landscape? How might a large college like Dartmouth College help and support in this time? And what are the best ways to deliver the information we've collected to the rest of the community? So again, in this type of community-based participatory research, we ask these questions of ourselves, but we also ask these questions of our community partners to keep improving the research process and making it more participatory as we go. So this is just kind of modeling that participatory research framework. So we had, these are slides from we just presented, but we had a big chat for half an hour with a lot of community partners about what to do next and what to do with these findings. So I'm just gonna, before we turn into some question and answer, I just wanted to show a few slides from this great study. The citation is below. I shared it with the leaders of this presentation, so they'll be able to share it out via an email afterwards. But the lead author is here at Dartmouth as a postdoctoral scholar right now, Lene Turek-Hankins, and she came in, spoke to my energy justice class this spring, and their study is amazing. I think it shares some similarities with what you all are planning to do, and I'm happy. I think Kate just met Lene, so I'm happy to help follow up. But basically, on the right hand of your screen is a graphic abstract of their article. So it's understanding 4 causal pathways that explain which households are heat and or energy burdened in a chronically hot city. And so basically what they're finding is, and I think this is going to be important for your research too, is that some households are heat burdened and some households are heat and energy burdened. So that means that some households are too hot, but they don't have as much difficulty paying their energy bills. And the most, the households that are most suffering are both heat burdened and energy burdened. So one of the key differences is like, what is the structure that they're living in? Because if you're living in a structure that has poor ventilation or has a higher kind of hot temperature on average throughout the day and throughout the evening, and doesn't ventilate, then that's going to be more costly, or it's going to make you more uncomfortable. So what they did, and I don't know if that's possible for your study, but I do think it was really cool. They put thermometers, like low scale thermometers, in people's homes, obviously with their permission, and compensated them for being part of the study. But they were able to study over time which households were heat burdened and what was their curve of heat that they experienced throughout the day, afternoon, evening, and night. And then they better understood the left side is just getting at the different overlapping drivers and modulators of energy, of indoor heat exposure and energy insecurity. So I think that'll just be helpful. It's a pretty dense graphic, but I think that'll be helpful for you to look through later and think about with your study. So I'm just going to pop over to the final slide here that I have, which is some of their research questions. So again, these might be helpful for you to think with, but I felt too hot at home almost every day, about once a week, about once a month, or never. I experienced physical or mental health impacts caused or worsened by the heat in my home. And again, that one is like, it's important to ask people, but you might find in focus groups that people who say they didn't experience these actually share aspects of experiencing these when they speak about it, because sometimes we don't want to or don't realize that what we're experiencing is a physical or mental health impact, but then we share a lived experience and it actually is. So that's one that I would say, like, a difference between a quantitative approach and a qualitative approach might show different findings. I limited my AC use, like what you all were talking about earlier. They don't have the money. They might buy the AC unit, but they don't have the money to pay for using it all the time because, or at the temperature they would like to because it's too expensive. My energy bill was affordable. Never, not often, sometimes, always, or most of the time. I had to give up critical expenses such as medications, food, or school supplies to be able to pay my monthly energy bill. So that's that total insecurity, and that's how these researchers chose to get at it. So, yeah, I think I'll leave it there to open up for questions and chat about if I can be helpful in thinking about your research approach. But, in general, I do think I'd be curious if there are any efforts in Singapore to make some of these buildings better ventilated or better isolation so that people don't have to like I don't know what the building structures are, but that's a big effort in on our region is to like basically make houses better weatherized, which means like they're kind of less leaky for keeping the heat in. So that's one of the kind of, and there's more affordable approaches to do that, that can make these AC units or these things work better. Like that renter, the researcher making homes better ventilated, that sounds like a great approach too. But yeah, I'd be curious to know more about that. But thank you all for having me and happy to chat with you all about your research now or answer any questions you might have.
Thank you so much, Dr. Sarah. I think your introduction, there were a lot of things that I think overlaps with our experiences, and even though kind of the context of cooling in your region versus heating that we see in Singapore, I think a lot of similarities, and I think a lot of things that we can take away as well in terms of the research and methodology that you guys have been doing. I think maybe to quickly answer your question, and then we'll pop into the Q&A in terms of making homes better, I guess, acclimatized to changing temperatures and climates. So I think in a similar way of how maybe in the US, making homes more insulated and helping to ensure that that, residents are better able to acclimatize to colder weathers. I think in Singapore, a lot of us live in public housing, and that the design of public housing is very kind of done by the government, and the government has been exploring things like introducing paint that reflects like heat and allows for more cooler environments within the houses. And also because there's a lot of dense population, public housing is basically like a bunch of people living in blocks. So I think they're also looking at how can we make energy appliances in Singapore more energy efficient, and so households in Singapore have kind of vouchers to purchase energy efficient appliances, be it fans or air conditioning units, and that's also something that we also see as an area for engagement with residents in terms of usage. But then you have a question of once you've gotten the appliances, what about the long-term electricity costs? So I think this is a great way to segment to our Q&A. And I think from the chat, we've seen some questions. So to perhaps start off, how have your team kind of understood temperatures and experiences? The specific question was about recording temperatures in house visits. I'm not sure if that's relevant to your research, but if you could share perhaps some ideas or some insights on how your team has understood the housing situations of the communities that you work with.
Maybe I'll start and then Archie, if you want to jump in too in all of these answers. But we in our research we didn't do house visits. I know other studies that have done that. And we personally have not studied temperatures. We have worked with groups who do what's called a blower door test. And they call it broadly, it's an energy audit. Now, I think it'd be interesting to see what are best practices for extreme heat and energy audits. Here, it's really about seeing where there's air leaking out of a house. So like windows, door frames, other places, and using at first like low cost approaches. Like there's these kind of like window inserts that are plastic that can help really keep a home more less leaky at the windows that are put in, and there's a nonprofit that like supports them going all over our region. So that's one way that there have been home visits, and we've participated with groups that do that. This study that you all now have the PDF for, and we could help follow up with the researcher, they actually use these like small devices that are thermometers that went into people's homes. And I can say like I was not part of that study, but I do community science with water quality and using different technologies to like have people measure what's happening in their homes. This one, I believe, they weren't that expensive. They went into people's homes and then it sent the data directly to a cloud so that data could be analyzed. It's not like anyone in the home needed to specifically do anything. I do think you could look at, I mean, and I could help you all look afterwards. I think there probably are studies where it's been more like people in their own homes recording temperatures at different times, to do a lower budget version of monitoring temperatures. So I think there's different ways depending on the budget and access, that you could get at this, but it is really telling to actually see the temperatures because one thing is perception and the other thing is what people are actually living with temperatures. So I think that's the strength of the study I shared with you all is that they're able to pair people's lived experiences with the actual temperature data to understand like they found, you'll read about it, but there's like four kind of groupings of people's experiences. And that's important to think about designing policy solutions. Like, what are the four types of experiences people are having, and how might each one of those types be best served by policy changes?
Yeah, I think that's amazing because I think there are different ways that we can explore this. And I think you brought up some really great pointers and solutions that we can consider. Um, I think another question in the chat, and I also at this point want to encourage if anyone in the audience has any questions and you want to just unmute and ask, feel free to do so. Or if you are more comfortable to drop your question in the chat and we can ask it on your behalf. I think Christina mentioned about wanted to ask about how you shared your methodology or how you framed the issue of the energy burden when it came to your interviews and your surveys. How do you basically broach the topic and start getting to understand people's experiences? And I think the context for this is when we were engaging the community on Saturday with the seniors in Singapore, it felt like I guess heat and energy is not on the front of mind for a lot of residents. And I think there was some difficulty from the team in terms of how can we, start a conversation about that. And I guess from your experiences interviewing and speaking to the community, what has been helpful for you?
I'm going to give one idea, and then Archie, I feel like you've done a lot more of the data collection, so I'd love to hear your response. The thing I would say is like, you have to start your research somewhere, and you might not have the best entry point the first conversations you have. But one of the things that I think is important and when you're listening to people's responses is to find relatable experiences. So for your topic, I don't know what that is, but like you're going to start to hear people making different connections, right? And it might be like, who knows, when their grandchildren come to visit, that their grandchildren are uncomfortable, or when there's a certain event happening in the afternoon and they can't do it because they're uncomfortable in their home. Whatever people start to talk about and kind of finally make the connection, because they might hear heat and they might say, I don't know what to say about that, but they might know whatever it is, like sweating in their home and being unable to do their workout in the morning. Or so when you start to hear people's experiences and hear it a few times, then you can bring in the examples that people bring in to talk about why these issues matter. Or if there was a time when there was a power outage and people were really uncomfortable, or like an extreme heat event, and it was really present on the news that people died or that there were other issues, like there's different ways to bring in the topic and make it matter to people. But I think it's like at the beginning, just listening for what matters to people when you finally break into the topic and they make connections with their own lives. But yeah, Archie, what's been your experience?
Yeah, I fully agree with what you're saying. It's about like finding those relatable experiences. For us, I think just sort of mentioning like heating and energy didn't really come across to a lot of residents, but when we specifically mentioned rising energy costs in the area, because that's so relevant to a lot of people's daily lives, like that immediately piqued their interest and they wanted to talk more and hear more about like what we were doing. Um, I guess specifically in the context of our research, because we were also interested in exploring total insecurity as well, and how energy experiences sort of leak over into other sectors of their lives, we would also ask about like, have you ever had to like hold off on paying a bill for like rent or something? So there's sort of a lot of ways to get to the point. I think it depends on the scope of your study, but I do think like the first step, like Dr. Kelly said, is to just get out there, talk to people, see what gets people interested, what the common experiences are. And I think that's a really good way in.
Yeah, and I think that's something that I guess it's very important in doing these kinds of community engagements and research in terms of understanding what the community experience, and also trying to understand from their experience the empathy and the communication. That's something that I think is really important. I think on that kind of note, maybe another kind of question would be, was there a specific demographic or scoping in your research in your project? And was there a specific reason or justification for a specific demographic or community chosen?
You know, we started out with not having a demographic chosen. We just started out doing the surveys to get out in the community and see who was most affected. Our hypothesis was that renters and people on disabilities or fixed income would be the most precarious. And I think that that's proven to be true in our findings, although I think we've had a stronger indication that people on fixed incomes are more precarious than renters because of, I think, the places we were located. I believe that we could do another study and try and get at just renters, and we'd find another data set. Like it's been harder to access renters just because of their interest, their age, demographics. They're going to be, and because they're getting pushed out of these areas. So that being said, when we got to doing the interviews, I think that we generally received availability from people who were elderly or older in general, and that is probably partially because of availability and also partially because of that's one population that's most affected. I know, Archie, would you add anything else there?
Yeah, I agree with that. I think we ended up mostly getting responses from like older residents. That was also just because a lot of the areas that we like surveyed at, some of those areas were like places that provided like free meals mainly to elderly residents. We also surveyed at senior centers. So yeah, we were just able to reach the elderly population a lot more in this area. I think it's also interesting because some of the populations that we were trying to reach in this area that are the most vulnerable, they may face other challenges in like getting out into the community, like in terms of transportation or something like that. And so we were sort of limited in the people that we were able to reach just by the nature of like vulnerable populations in general.
I think understand, and I think um, this makes a lot of sense in terms of the kind of audience and community that you have access to is also very kind of determined by the kind of availability and resources that they have, and also your access and channels to communicate and engage with them. I think that's a really interesting question in the chat that just popped up about how or being curious about whether the research that you guys have done has been translated or has not been translated into actionables. Have there been any specific recommendations? What are some of the spaces available for imagining and implementing the solutions? And very loaded question, but what are the difficulties of them bridging the research and solutions that might be specific to projects on energy burdens and insecurity? So the full question is in the Zoom chat, but basically any specific recommendation and actionables from your research. What are some spaces for solutions? And what are some difficulties in bridging research and solutions?
I mean, I guess I'd say that one thing is it's kind of like you have to be putting some band-aids on the existing issues, right? That might feel unsatisfying and that like they're not addressing the root problem of this. So I do think it's important to really think more transformatively about like how are we building our buildings, right? Like how are we building for climate adaptation so that people don't need to be paying so much for AC, right? And I guess it's like how are the buildings being built? How are the utilities structuring their payments for different income brackets? What are the technologies available to cool homes? Like there's different places of entry to make change in policy, and I think all of them are needed, right? Because if developers keep building apartment buildings that are not best ventilated, it's going to keep being a massive issue, right? So it has to the building ideally has to change. So and that's what we're seeing, they're changing the standards for manufactured homes, which are some of the low income homes that are most vulnerable to climate change and hardest to heat. Like they're trying to raise standards for those so that people, to get at that root issue. And also different mechanisms to support people getting more like better appliances, more energy efficient appliances. And then what our study has more focused on are those the policies that support, helping people pay for filling up their heating tanks and for paying their energy bills and other costs. And like, while those are band-aids in a sense, like they're necessary because people are suffering, right? So those programs have to continue and they ideally need to be expanded, not defunded, which is what we're focusing on right now, right? But it requires a bigger group. And like, I guess I would say that, what I see at Dartmouth and with our students is like some students want to do everything and no one student can do everything, but if each of you have different interests that are complementary, like that's really powerful, right? That you can work on different solutions together. But yeah, Archie, what do you think about that question? It's a big one.
Yeah. Yeah, I mean, I think that our research has obviously sort of shifted as we've progressed on the project. I think initially our goal was to help support our community partners in terms of providing them with better quantitative data points that they could use to like fund like weatherization efforts and things, like apply for federal funding, which is now very different. And so we just held a community conversation last week where we invited local service providers, local people involved in energy to sort of come share their experiences, sort of trying to navigate this new funding landscape and also just talk about energy insecurity in the Upper Valley and like also consider how Dartmouth can plug in. And that's something that I'm really interested in exploring next is like understand more how like Dartmouth as an institution can leverage its like power and privilege to help um, local service providers sort of navigate this like funding landscape or like fund like weatherization projects in the Upper Valley. So yeah, I mean, I think like where I'm at right now is like trying to take stock of all of the resources that I have as a Dartmouth student and sort of see how I can best leverage that to in conjunction with like the knowledge that I've gained through this project to try to make an impact. So yeah, I mean, this question is one that I've been thinking about a lot, and I don't really have a specific answer for right now, but it's something that I'm very interested in exploring further, and hopefully will lead to some good change.
I think that's great. You guys are doing amazing work by exploring the issue and then thinking about solutions. And I think we are really coming up to the hour, and I just want to open up the floor to anyone who has any last questions and you want to like verbalize them. And then also as a second kind of action, if any of our volunteers from the SYCA team would like to share your experiences being involved in this project so far. Yes, I would just open the floor to anyone who has any questions or thoughts.
And then could I just say one quick thing? I was just reading someone writing about the social workers and how to involve them more. I mean, like one really basic thing, I don't know how you're doing it, but is like just diagramming out what your research process is, right? And showing it to people and being really clear about the steps and then asking for the social workers or other people's experience. So like, and as it changes, showing them again what your research process is. But yeah, I'd love to hear people's experiences. So I'll stop there.
Yeah, there's a question in the chat. about new technologies like EVs.
Okay, so I guess that can be one of the last questions. Chelsea asked about how Dr. Sarah mentioned residents' hesitance towards new technologies like EVs. How feasible and receptive do you think deploying new technologies for heating and energy would be like in New Hampshire?
You know, I couldn't answer that across all heating and technologies. I know that we have a group at Dartmouth that's really studying heat pumps right now and how people are uptaking those. One of the big challenges is that you can't install heat pumps until your house isn't leaking, right? From like if you're so you have to weatherize your house and get it ready for heat pumps. And if everybody transitioned to heat pumps, that would overwhelm our grid. And so it's like there's a bunch of changes at different levels that need to be considered. One thing I have seen is there's some more interest at the town level in geothermal energy and district heating, which is like when a lot of houses are heated together, and it's kind of informed by how Denmark does that. So the piece I've seen there is like that's where Dartmouth, our college, is able to kind of share its experiences and help towns navigate some of those decisions. And like wealthier towns can share their experiences and help towns with less resources explore options. So I think sharing experiences from like those that try out the new technologies with people who have more distrust or less income to try those out is really important to help educate and inform people who want to make changes but have less income to do so.
In conversations with residents, I got the impression that people weren't entirely opposed to new technologies and like new energy systems. It's just that they were very unsure about like affording it and maintaining it. I think a lot of what goes into it, sort of what Dr. Kelly was mentioning about just sort of the education and outreach piece of ensuring that people are comfortable with technologies and understand, how it can work for them and how it can help them. And a lot of it does come down to like the finances and whether it's financially feasible for people to implement.
Understand. I think that's a great point in terms of how this whole problem is very complex. There are multiple steps, and new technology is one step in the process. And with communities, it's about understanding and the process and also helping them to get through and being more knowledgeable about different solutions and ways. I think it's a good time to wrap up. And maybe if there are any questions or follow-up conversations that we would like to have, we can definitely compile them. But now I'll just hand over to Kate, I think, I will be doing the closing. Sorry. So let me just share some next steps. If anyone could share the screen.
Yeah,
Sorry.
I got you.
Thank you.
Okay.
Okay. So I think thank you so much to Dr. Sarah as well as Ashi for joining us from the Energy Justice Clinic and sharing about your amazing research. And I think just from my perspective, I think there are a lot of similarities and pointers that we can definitely learn and take away. And just really all the best with all the work that you're doing. And I think we'll love to follow up as well. Second thing, thank you so much to Rachel from Energy Collab for collaborating with us on this amazing webinar. Energy Collab on Insta, they do like amazing Telegram channel with like news articles and like very good like knowledge pieces coming out. Also on Spotify, search Energy Crossroads. Yeah, a lot of cool stuff from Energy Collab. And lastly, for Singapore Youth for Climate Action, feel free to follow us on Insta, join our Tele channel. We have a community that is very active, a lot of discussions. And also if you want to support the heat vulnerability outreach program that we're doing, feel free to contact Kate or myself on the Tele. And I think that's the shout out for all the amazing people involved here. And let's do a group photo.